Hello, I'm Bill Labaris. I'm the editorial director of the Enterprise CIO Forum, and I'm lucky today to be joined by Kathleen Healy-Collier, who is Administrative Director of Operations, Systems and Technology at Le Bonheur Children's Hospital in Memphis. Kathleen, thank you very much for being my guest today.
Absolutely.
Let's talk a little bit about IT that matters in healthcare. Now, if you look out, Kathleen, of all the emerging, so-called hot information technologies and solutions and trends that are out there, whether it's social media, mobility, big data, whatever, which do you feel of these or any others have the greatest potential to have the biggest impact on the healthcare environment, and why would you feel that way?
Well, probably a combination of big data, the mobile environment, the current regulatory push to move to electronic medical records across the entire healthcare continuum, probably sort of a combination of all of those. And probably these factors combined with the consumers' increased engagement in their healthcare and willingness to track their own information via the web or a mobile device. This can dramatically change really the healthcare environment in terms of access to information, the ability to translate large data sets into meaningful information, and can actually provide better care.
Mm-hmm. And so the baseline communication, say, between the patient and the providers can actually increase as a result of all this as well.
Absolutely.
I mean, that's the bottom line, I suppose, when it comes to the hospital, is patient care and the quality of the care.
Right. And to have patients actually engage in that care away from the actual hospital environment or the physician office creates a link that we haven't historically had.
Right. Okay. Now, if you look out at all of these are emerging technologies in many cases, big data with a lot of predictive analytics. The mobile world is literally exploding, and it's causing some challenges as well. Do you feel there may be some impediments or challenges to most effectively leveraging and exploiting these trends and solutions, or what might the impediments be?
Absolutely, and you touched a little bit on a few of them, I think. Obviously controlling for security. In terms of breaches, a lot of this is very high-level confidential information. So keeping your systems and your firewalls up and making sure that those data that are being exchanged are secure in those pathways. Also, privacy. So in so much that you're, bringing the consumer in, and they seem to be more open to sharing. It's really surprising how much the consumer is sharing online. But at the same time, balancing privacy and making sure that so that the right controls are in place to assure the right privacy for the patients.
Absolutely, yeah. I mean, and of course, the healthcare in general is one of the more heavily regulated, industries, businesses that want into business, but organizations out there, and right, the security piece has got to be a major component.
The other thing I would add probably is also ensuring that the data itself is meaningful. So you've got all these data items out there, data elements, and we have to make sure that it's consistent and reliable, and it has a high level of integrity. And so there's some significant challenges when you're looking at aggregating a very large quantity of data that's maybe not inputted in as much of a standardized fashion. And making assumptions about those data when you're taking care of patients. So that's another big challenge, is making sure that those data that we're using are meaningful.
Okay, excellent. So if we look at these things in context, the impact of these technologies and that are emerging, and trying to deal with some of the impediments. If you look out, say, 3 years, maybe 4 years, which is, I guess, you might call the midterm going out, what do you feel is going to change the most in the healthcare field and the way IT is leveraged, say, versus the way IT is used today?
Absolutely. So I think we're going to see a very significant transition, because we will be able to leverage a lot of these technologies. As our IS systems across healthcare evolve, there's going to be, hopefully, a higher degree of confidence related to improved standardization, the accuracy, security, and access to those clinical data. And as the consumer moves more and more into this willingness to share their information, and there's larger global data sets that we can actually impact the way that care is delivered and the level of care that they're engaged with, I actually think that these provide the ability to leverage all of these tools in a way that could potentially influence lifestyle changes as well for the consumer. So it impacts the patient at the point of care, you know, so we've got the data to kind of feed the clinicians in terms of taking care of the patients. But also, if the consumer's involved and they're able to leverage their own data, it could actually change the lifestyle in which some people might live. Maybe they will become more active. Maybe they'll have a better sense of what that means in terms of their future health. And these could actually make a difference not only at the individual level, at the patient level, from a clinician's point of view, but it could improve population health overall if people make these types of changes across the United States. Essentially, when you look at something like obesity or some of the heart disease concerns that we've had, they may make better food choices, you know, and better lifestyle choices.
Excellent. Well, lots of changes afoot, and you're in a great place not only to observe it, but to make it all happen. Kathleen Healy-Collier from Laverne Hospital in Memphis, thank you very much for being my guest today.
Absolutely. Thank you.